Changes in the pipeline for the Barbados Water Authority. A solution found to help elderly Barbadians abandoned at the Queen Elizabeth Hospital. And in sports, another heartbreaker for Trinidad and Tobago in the Champions League.
Credible, balanced, committed. This is the CBC Evening News.
Good evening, I'm Pearson Bowen. This is the CBC Evening News. A shake-up at the Barbados Water Authority is in the offing. Without providing details, Minister responsible for Water Resource Management, Dr. David Estwick, told CBC News he had received complaints of what he called certain practices within the Barbados Water Authority. When pressed for further information, the minister noted that under the laws of Barbados, he had a responsibility to ensure that proper fiduciary and prudential practices are exercised by the management of the BWA.
One of the weaknesses of statutory corporations management in Barbados comes from the fact that the corporations are usually too lazy to establish their own financial rules. The financial rules which existed under the Financial Administration and Audit Rules of 1971 applied to line ministries only. The provisions in the 2007 amendments to the Public Service Act delineates in law statutory corporations from that of line ministry operations, and also the Civil Establishment Act of 2010-2011.
The minister says he expects the BWA board to correct the anomaly as soon as possible, after which all those breaches which occurred will be dealt with.
Part of that will require some internal reorganization so as to make sure that we have the type of checks and balances that are required, and we will hold any individual or groups of individuals who collude to break those rules accountable. And I have said to the board that even though the Water Authority at this stage does not have a defined and written out collective bargaining arrangement in a large extent with the Barbados Workers Union in relation to many of the industrial relationship practices, there are well-established traditions that we will follow to protect the workers' rights via its natural justice principles and via normally accepted HRIR practices.
Government will shortly unveil several pilot projects while others will be reorganized in a move designed to provide a platform for sustainable farming in Barbados. Earlier today, Minister of Agriculture, Dr. David Estwick, said the new thrust included a revised farm incentive scheme, a farm mechanization scheme, a module of government's state trading enterprise, and a new cassava project. Minister Estwick was speaking as officials from his ministry conducted a field exercise to show the benefits of early greenhouse technology as it is applied to the growing of hot peppers versus open field production. Under government's proposed state trading enterprise, it is intended to link the supply of farming produce to the demand side to primarily reduce the country's high food import bill.
We are starting with Trimart. So Trimart is in a relationship with BAMC, operating a couple farms, and they are producing produce directly for the purchase of Trimart so that the farmer can benefit. And we create the infrastructure, and we create the institutional framework and the ICT platform to manage it. That means we will therefore know what is being produced every single month, how much is being produced, when it is going to be harvested, so that you can know, Trimart can now plan when they will use that product and so on and so on. The objective, therefore, is to move beyond Trimart into all the supermarkets who want to participate and expand the farmers who will participate.
The Agriculture Minister also noted that the state trading enterprise would serve to reduce gluts and shortages of local produce.
And then gradually, I would want to get the hotels involved, and I want to get the schools involved. And I want to ask the Ministry of Education, the Queen Elizabeth Hospital, because they purchase a lot of fruits and vegetables and other implements in Barbados. I want to get some of them to come on board so that we can drive the production side to satisfy their demand. But it must be done within an ICT platform that can manage the supply and demand in terms of time. And that's what we're working on.
Government has come up with a solution that will help those elderly Barbadians who have been abandoned by their families at the Queen Elizabeth Hospital. Michelle Arthur has more.
Parliamentary Secretary in the Ministry of Health, Senator Irene Sandiford Garner, who was charged with finding a solution to the problem, says the government-instituted committee to look into the issue has made several recommendations. But chief among them is the decision to relocate the elderly abandoned patients to government-run geriatric facilities.
Social care, through their poverty alleviation program and so, would have liaised with this hospital to find out what areas we could take up to bring those people in, because you know that there may be areas sometimes in the geriatric facilities that the elderly can access. And through the manager of this hospital, we located spaces which then would need staff and equipment. And that is being now facilitated by the hospital and the Ministry of Health to ensure that we can ease that load.
Senator Sandiford Garner says it won't be business as usual for those people who've left their loved ones at the hospital and continue to spend their pension checks.
Many of those elderly people have persons who are drawing their pensions. So the social care aspect, or the social workers from social care then were required to investigate who would have been drawing those pensions, find out what is happening with that money, and that money now will be kept by the government once those persons are brought into the state care system.
She says the transfer of these patients will ensure that more space is available in the A&E department.
There is an area on the perimeter of the A&E where if you pull the curtains or even walk over, you would see elderly people in there, and they are residents of the hospital. So that when you come in now with an emergency, a genuine emergency, when you come in with a genuine emergency, you cannot access those beds. So sometimes you may be out in the waiting area, and the observation areas that you should be in so that you can be monitored by a doctor are taken up, the beds are taken up by the abandoned elderly.
Those patients that are more mobile than others will be relocated to district hospitals and other facilities in rural areas. Michelle Arthur, CBC News.